Precision medicine goes to a level where they say, well, I will give you a lot more information than you actually have. So you get information on multiple levels, and you sort of bring all of that information in. Now, this sort of means that you need to make the data in a way, or present the data in a way to the clinician so that he can sort of understand it again. So you can make a lot of information, then you have to interpret it, and then you have to bring it back to the clinician in a way. And then, of course, when you have all of that, when you've now suddenly thrown high resolution information at the clinician that he then has to transmit into therapy for the patient, then you sort of have far bigger options, or you can be more selective or more specific in how you do that. We have two pilot projects running at the moment, one in rare diseases and one in cancer. So where we are taking genomic information from rare disease patients and integrating it into this system, and information from cancer patients and integrating it into that system, and then coming up with a sort of decision support for the clinician. So the system sort of generates a decision support, puts the most important things on the top, and actually generates a sort of PDF clinical report that you can print out or look at on the screen, and then say, this is your information, the most relevant. I think there's a big responsibility of the people who sort of can do these high resolution analyses to also present the data back to the clinicians in a way that he can sort of look at an A4 sheet of paper and say, this is what I need to do. Take all of this information and then try to distill that information down to something very manageable in 10 minutes in front of a patient.